sorry. Um, which of the following structures is most likely affected in this patient? So a 45-year-old man has a 2-year history of gradually worsening tinnitus and difficulty hearing high-pitched sounds. He denies any vertigo, ear infection, or exposure to loud noises, no abnormalities, and the audiogram reveals a bilateral high-frequency hearing loss. In terms of the diagnosis, so worsening tinnitus and difficulty hearing high-pitched sounds, I think there's something wrong with like the tympanic membrane, perhaps.
Okay. I'm going to let you think through this. Of course, as an ENT, right, I have a very, specific way to think about this, but I'm going to have you think through this. Okay. And then I want you to kind of pick an answer choice and we'll go through it together.
Sure. Okay, so no vertigo, no ear infection, nothing like that. So I think the most important takeaway from this is that bilateral high frequency hearing loss,
Okay.
um, in which I think because it's high frequency, could it be like deeper into the ear?
Okay.
I don't know how well I'm going with this.
That's okay. What does your
Um,
gut say? What do you feel is your gut answer choices?
I think I'm also leaning towards like stapes is the bone, right?
Mm-hmm. Mm-hmm.
Stapes is the bone. The bone can't be affected
Okay.
in this. Thank
Bless you.
you. I think the only one that just makes sense with my little knowledge of this is the tympanic membrane.
Okay. So let's go with that. All right, so let's talk about this together. Okay. Obviously it's an ENT question, so I love ENT, of course, right? Or else I wouldn't have become an ENT doctor. So let's talk about it here. First, actually, before I start drawing, let me finish drawing. So here's the pinna or the auricle, right? It's the outside of your ear. Here's your ear canal.
Mm-hmm.
Okay, here's your tympanic membrane, right, which is kind of the eardrum, right? You have three ossicles, right? So you have your malleus, you have your incus, right? And then you have your stapes, right? And then sits on the right oval window, right, for your cochlea, right? Um, so let's talk about this, okay? Um, what portion, right? How do I phrase this here? First, actually, before, let me back up. Okay, so the ear is split up into three parts, right?
Okay.
You have your outer ear, outer. Okay, you have your middle ear, middle, and then you have your inner ear. Okay, split into three. Okay, outer ear just means your ear canal and your pinna. Middle ear is your three bones, right? Your malleus, incus, stapes, right? And your inner ear is your cochlea and your nerves. Okay, your cochlear vestibular nerve, right? And also your vestibular system, right? Your semicircular canals. Okay, but we're not going to talk about semicircular canals because that deals with your balance. Here, we're only talking about hearing. So, what kind of hearing losses are there? There's two types of hearing loss. Do you know what types they are?
Um, I'm embarrassed to say no, but
No, that's okay.
no.
Don't be embarrassed. No, don't be embarrassed. There's two types. So there's conductive hearing loss and there's
Oh yeah.
sensorineural hearing loss.
Right.
Okay. So what's the difference between conductive versus sensorineural hearing loss? Can you describe it in your own words for me?
I know we do like that test with it.
Okay, the tuning fork test.
The
Yep.
tuning fork
Weber and
test.
Renee. Yep. But so conductive, right? Conductive means that it's a mechanical issue.
Motor. Mm-hmm.
Does that make sense? And sensor and
Yeah.
nerve is exactly what it sounds like, right? It just means the nerve, the nerve component of hearing, right?
Mm-hmm.
So Conductive meaning that, let's say, give you an example. So if you have a lot of wax, you can have cerumen impaction, which blocks sound to get to the eardrum. That would be conductive hearing loss. If you have a perforation or a hole in your eardrum, that'd be conductive hearing loss, right? If you have a dislocation of the small bones or otosclerosis, which kind of glues them together, that would be conductive hearing loss. Sensory hearing loss happens from the inner ear and on. So if you have any kind of damage inside the cochlea or to the nerves that kind of transmit information from the cochlea back to the brain, anywhere from here on out will cause you sensory hearing loss. Do you get the difference between the two?
Yeah.
Okay.
But how does that happen?
So now I'm going to talk to you about that. Okay.
Oh, sorry.
So no, that's okay. No, that's okay. So this patient, right? You have to
Mhm.
first categorize. Does he have conductive or sensory hearing loss? You tell me.
Hearing hybrid sounds.
Mm-hmm.
I want to go with sensory.
Yeah, sensory hearing loss because it's just the high frequency sounds, and he doesn't have any kind of. It doesn't say that he has kind of any kind of cerumen impaction or perforation or eardrum rupture or anything like that. So more than likely, he has bilateral high frequency sensory hearing loss. Okay. So you have to pick an answer that can give you sensory hearing loss, right? A tympanic membrane will cause you any kind of issue, would cause you conductive hearing loss. Stapes issue, conductive hearing loss. Eustachian tube, in theory, it kind of gets you muffled, but doesn't really cause you true hearing loss for the most part, right? So not going to be an issue here. Oval window, right? That is not going to give you this bilateral sensory hearing loss either. Okay. That can cause also conductive hearing loss if it's included with otosclerosis. So the only one that can really fit with sensory hearing loss is going to be kind of your organ accordi, which is inside your cochlea.
Okay.
Okay. So that's kind of the most brief. Obviously, ears are very, very complex in the ENT world. So, I mean, I can give you a whole spiel about it that could probably last hours and hours, but this is, I would say, probably maybe even a little, it's probably on par for step one. This is as far as you need to know.
As far as you need to know. Okay.
Yeah.
Where is the eustachian tube?
The eustachian tube, good question. The eustachian tube actually connects the middle ear space to the back of your nose or your nasal pharynx. And so the eustachian tube, right, is an equalization of your middle ear to the outside pressure. So, when your ears pop, that's caused by your eustachian tube.
Mm-hmm.
Or when you get sick and you feel like it's muffled outside, that's because your eustachian tube is swollen up, and so the pressure is not equalized well. So you feel like you have that head fullness or the oral fullness. That's from eustachian tube issues.
I see.
Mm-hmm.
Nice. One other question. So with this question, right, because of the high frequency loss, but
Mm-hmm.
let's say if like the question mentioned like, oh, he had like, I don't know, like too much wax, but also had high frequency loss. Now that would be considered conductive, or is high frequency just
Yeah,
for
yeah.
sensory?
Well, I would say, I mean, once again, this I love
Combines.
ears, right? We can
Yeah.
go, for a long time talking about this, but yeah, if you have cerumen impaction, usually it's not going to just be high frequency. You're going to have other frequencies of loss too. You get what I'm saying?
Mm-hmm.
So it's not going to just be isolated high frequency. Isolated high frequency is very rare for conductive. It's usually sensory nearing.
Right.
Okay.
Sensory. Okay. Just one last thing before we move
Sure.
on. So wait, let me. Sorry, I'm trying to write this down. So outer ear, in that we just have the pinna, I guess. Pinna.
Mm-hmm.
That's what it's called.
Mm-hmm.
Middle ear is where we have all the bones,
Yep.
right? So like the stapes, and then essentially like inner ear, we have what's it called? The organ of
Well, you have
Cordy,
the
like the
you have the cochlea and the semicircular
cochlea.
canals, and then inside them, it's broken up even deeper, like the organ of Cordy, the basement membrane, things like that. And so, inner outer hair cells, all those things that, if you remember, once upon a time you learned about. But like I said, you don't have to get too deep into what's in the cochlea because they really don't ask you that.
Okay, just a general idea. Okay, I think I got it.
Perfect.